Welcome to Metropolitan Community College, Penn Valley Health Science Institute. I'm Sandy McElnay, Director of Health Science and former faculty member in the Allied Health Division. The Health Science Institute was based on my experience teaching with Metropolitan Community College for over the past 15 years and feeling frustrated that there were a lot of opportunities for creative out-of-the-box instruction, but because the programs weren't centralized and the way that instructional delivery was given, there wasn't a whole lot of opportunity for anything out of the box or creative. So therefore, I got to thinking that really to do a real instructional shift around the health sciences, that we needed to centralize all of our allied health and nursing programs under one roof, to include our non-credit short-term health careers, to our one-year certificate programs, to the two-year associate degree programs, and then hopefully develop partnerships with the four-year, and they could provide some bachelor level like the BSN Bridge program or a bachelor's in healthcare technology that would appeal to some of our allied health students. That way, in one building, we would have all levels of learners that could mentor one another through the learning process and hopefully engage them on a track of lifelong learning. We initially were planning to build a building on the main campus. We were going to have a building that was 120,000 square feet and was going to cost $70 million. And so we were struggling with the cost and the lack of space and not being able to meet the whole vision. And then this building, the old American Century building at 3444 Broadway, opened up, and we were able to acquire this building for $3.5 million, and it is 190,000 square feet. So we purchased this building, and the final project came in at about $25 million. It's a combination of bonds from the district and a $12 million capital campaign, and then enhancement grant and various other grant dollars. And so we feel very fortunate to have 190,000 square feet with the final budget coming in around $25 million. We moved all the programs January of 2010, and it is designed to be application of knowledge on high-tech, state-of-the-art equipment. Entities that we focused on when we designed the whole concept of the Health Science Institute were students, community members, and business and industry. Students wanted more hands-on, state-of-the-art learning, and we really need to focus on student success. We don't have trouble attracting students to the health sciences, but we have difficulty retaining students because of the rigor, especially around the sciences. And then the community here in the urban core Midtown area, their number one concern is access to health care, prevention and wellness, medical supplies, and just general information around health care. And so we thought, shame on us being the community college that has about 13, 14 allied health and nursing programs, and we're not engaged with the community and aren't doing more around prevention and wellness. And then the third entity is business and industry. And I felt like, we're doing a lot of employee training for business and industry. Why not try to figure out creative partnerships with that industry so that we can deliver the education and give them the type of employee they want, and even revise a curriculum to meet the particular needs of that business and industry. So one of our first partnerships is most likely going to be with CVS, and we will add a mock pharmacy here at the Health Science Institute and train all their pharmacy techs and tweak our curriculum to meet the specific needs of a CVS employee. So that's just one example of the potential business partnerships that we could have here at the HSI. So let's move forward with the tour. There are 5 levels here within the Health Science Institute. The 4th floor, the top floor, houses the Allied Health and Nursing Division, administrative offices, and IT support. So it's basically office space for faculty to do their work and for students to find out information about programming. So let's start our tour on the 3rd floor, and we'll start In the corner over in the operating room suites, we have 2 operating room suites. We've got a sterilization room, a scrub room, and a sterile processing room. This whole suite was designed after St. Luke's on the Plaza, and everything is fully functional and operational so that our students can actually feel the experience of actually performing in a real OR setting. We have ORA is equipped with gases so that if medical simulation ever gets to the point where the mannequins, you can use mannequins in the OR, will be ready, and then this OR can be an extension of our virtual hospital, which is located on the first floor. So the whole flow is designed that when the surgical tech is done with the surgery, that they take the patient and take all the instruments out of the front of the OR suite, come around through the first sterilization room. That's where they rinse and do the first decontamination, put it through the sterilizer, then come back through the wrap and sterilization room. And so the process and the flow is out the front of the ORs, around through the sterilization, and it's the same process that they'll do when they're in the actual setting. Across the hall from the ORs, you see health information technology, medical transcription, and coding. We have dual monitors, and we also have a relationship with Cerner Corporation's AES division, and we use Cerner's electronic health records and Cerner's electronic medication system. You'll notice as we're walking through the halls, there's windows and then speaker systems into all our labs. The concept we put in here is if we're going to have state-of-the-art high-tech learning taking place, why would you close that off? So we have the windows into learning concept where grade school, high school students, community members can tour the Health Science Institute at any time and watch and listen to high-tech learning taking place. So it's a win-win because then they don't interrupt the labs and they're able to see learning taking place, and hopefully for prospective students, it engages them and excites them all around the health science arena. So as we go down the hall, the next area you're going to see is our nursing skills lab. We have a 16-bed nursing skills lab and then a 4-bed skills lab. All of the head walls are live, and all of the beds are state-of-the-art current technology that you'd see in the healthcare environment today. The only difference between the practical nursing side of the skills lab and the professional nursing side is we do have critical care head walls on the associate degree nursing side because they provide a little bit higher level of care. And then as you can see when we're leaving, we've got the training restroom, the linen room, and you can see Cerner's electronic medication system. So as we leave the nursing skills lab and we're going down the hall, the first room on the right belongs to the Occupational Therapy Assistant Program, and in this room they do their hand rehabilitation, they make splints and braces, and then on the other side they do their assistive technology class. And this is where they train students on software and technology that allows individuals with cognitive or physical challenges to perform independently as possible in their environment. We're not going to tour that today, but we do have a low vision lab that we're trying to create in partnership with Alpha Point, and it's our hope one day that we can offer a low vision clinic that not only involves the occupational therapy students but also provides a community service as well. Moving down from the splinting and assistive technology, the next room you see is physical therapist assistant whirlpool room. The whirlpool actually works, and the suction on the wall actually works, and this is where they talk about wound debridement and treatment for wounds and whirlpool treatment. The next space we're going to enter into is the physical therapy assistant gym. In this gym you'll see parallel bars, steps. This is where they do gait training, balance, strengthening, therapeutic exercise. We have potential to partner in this area with the Kansas City Free Clinic and the Rockhurst Occupational Therapy and Physical Therapy Program to provide an evening clinic in this space here, which would be a nice business partnership as well as a community outreach. And then as we go around the corner out of the rehab gym into the big OTPT space, you'll see traction tables. They do trigger point massage, joint range of motion, manual muscle testing, and then they have computers along the wall where they have software that deals specifically with intervention techniques and probably anatomy and physiology information that complements the learning that's taking place in those labs. As we leave occupational and physical therapy assistant, we're going to go across the hall into the home living suite. As you walk into the suite, you can see that there's a kitchen to your right, and to your left is a living room area, and then you have a home office space, and then you have the washer, dryer, toilet, tub area, and then in the back is a bedroom with a bed and a closet, and if we're doing stuff around home health or hospice, we might put a hospital bed in there. But in this space, we can take people that have had physical and or cognitive disabilities and work with them on being as independent as possible in a home living environment. The occupational therapy program actually brings clients in from group homes, and they do cooking and how do you adapt when you're trying to do a meal prep from a wheelchair, or if you have visual impairments, how do you move safely around your home environment, how do you manage your clothes, how do you transfer from the tub to the toilet, etc. And another thing we can do, which is really cool with simulation, is we can bring up one of the wireless mannequins and have the mannequin code in a home living environment while one of the physical or occupational therapy students is working, and they have to call 911, which is down in our paramedic division. The paramedics then respond to a home living situation. They have to interact with the OTPT student, and then they can treat the simulator in the home living environment and then transport them to the virtual hospital on the first floor. So it's a real life interaction and engaged learning. And what it does is allow for interdisciplinary instruction. So not only does the paramedic learn the role of a paramedic, but how does that role change when they engage with other healthcare providers such as the physical therapist assistant. That space provides for a lot of simulation opportunity around real life experiences. So now we're going to go from the third floor to the second floor, and we'll start back in the far southwest corner. And in that corner, you'll find a dental materials lab. This is where our dental assisting program makes bite guards and other various things. As we move forward down the hall on your right, you're going to see a 90-seat computer lab. We have the largest associate degree and practical nursing program in the area. We run about 80 students per class, so 160 students for the junior and senior level, and a lot of the testing and homework assignments and everything is computerized. So we do a lot of computerized testing in our health science programs, and therefore the need for such a big computer lab. And with the trend now moving towards mandatory electronic health records, we foresee that we're going to be doing a lot of training in this room as well. And then on the left side, we're going to enter the dental operatory suite. And in here, we have a 10-seat computer lab. We have the panoramic Seth X-ray, which is the stand-up, state-of-the-art X-ray unit available in dentistry today. And then next to that is an intraoral X-ray machine. And then you can see we have a consultation room, we have a locker room, and then as we go down, you'll see that we have 6 fully functional operatories, a sterilization room, and a storage room. We are currently in conversation with area dentists to hopefully provide a non-invasive clinic in evenings and weekends through the Health Science Institute in partnership with local business and industry. So therefore, not only do our students benefit, that the community benefits from a clinic-type setting, hopefully offered at low to no cost. And then as you go down the hall around the corner, we'll enter what's called the Health Resource Center. The Health Resource Center is an extension of the Student Success Center, which is located on the main Penn Valley campus. The whole design of the Health Resource Center was focused on student success and retention. So when you go in the Health Resource Center, you'll find the Nursing Retention Coordinator, the coordinator of the Health Resource Center who happens to have a health science background, a learning specialist, and then the compliance health careers coordinator who handles all the clinical compliance medical issues for all of the students. And in here we have 8 small study groups, a small computer lab, and a full-blown, fully stocked anatomy lab. We house in that anatomy lab any kind of multi-sensory learning tool that supports students through the learning of anatomy and physiology. That seems to be the one general education course that is most difficult for our students. So we wanted to provide as much in the area of resources as we could to help students through learning of the anatomy and the physiology. While they're in the Health Resource Center, they have access to laptops, to small group study areas, to books, to tapes, to videos, anything we think can support learning through the health sciences. There's a couple other things that are really different and interesting. One is we require or ask that the faculty spend 1 to 2 of their 5 office hours in the HRC or other common areas around the Health Institute, just engaging students on a mentorship level, not tied to a course, but just how you doing, what are you going for? And there's a lot of data around student success that says the more casual interaction students receive from faculty and other student mentors, the more successful they are in these programs. So we try to encourage faculty-student engagement outside of the class and also student-to-student engagement. Like I mentioned earlier before we actually embarked on the tour, we house all levels of learners. And so you could have that CNA student in the HRC studying, and in comes an associate degree student that went through the CNA program maybe about a year ago, and they can start talking, and maybe they're both single parents, and the one that's now in the professional nursing program can say, I was where you were a year ago, and these are some things that I did or I was able to do to help support me through the process. So it's that peer-to-peer mentorship and encouragement that I think is equally important, and that's the kind of engagement you're going to see in the Health Resource Center. So as we leave the Health Resource Center and we go to the right and down the hall and around the corner, you will find our Institute for Workforce Innovation. We usually refer to it as IWI, and this is the healthcare arm of that entity, which is our workforce continuing professional education arena, and they're the ones that manage and offer all the short-term non-credit health careers such as phlebotomy, CNA, pharmacy tech, any kind of continuing education and or professional development or business contract training. So it's a nice synergy to bring the non-credit workforce development side of the house with the credit side of the house and just integrate them and blend them and share resources. So that's been a really neat partnership to watch develop and to facilitate greater potential. And so now we'll go to the first floor. And on the first floor, we're going to go ahead and go into the Radiology Suite. And in the Radiology Suite, we have 2 fully energized labs. And the first lab houses the Definion, which is the highest end X-ray unit available on the market today. Everything is fully functional. So when students enter these energized labs, they will actually function as if they're in the real medical setting. And we're developing a partnership with UMKC's School of Medicine to use standardized patients so that actual standardized patients can come in, and when the radiology students are doing positioning, the standard patients who are real people from the community can give them honest feedback about their interpersonal skills, their communication skills, and their positioning skills. And so that's really good, and that's good for student learning to have that direct feedback from somebody from the community. And so then as you go through radiology, there are still several rural areas and small clinics and hospitals that don't have digital radiography, so we decided to keep the dark room. We still teach students film, and that way they're workforce ready, whether it be a rural small area that's not progressed to digital, or if they get a position in a state-of-the-art hospital, they can handle anything from film to digital radiography. And around the corner, you'll see that there's spaces for a sonography lab. The goal is to start an additional program, an Associate of Applied Science in Sonography, and hopefully have that curriculum complement our current radiography curriculum so that students that graduate from our radiography program with an AAS can attach one additional year to their curriculum and graduate dual degreed with an AAS in not only radiography but sonography. And of course, for employers, that's a win-win because they have a cross-trained person they can use in both the radiography and sonography section. So hopefully within the year we will develop an Associate of Applied Science in sonography. And then as we move forward past the sonography labs, we'll move into the classroom. In the classroom, you'll see that there's a non-energized X-ray unit, and this allows the students to play with the unit, to work on positioning, and get that basic skill set down and be comfortable with that before they move into the energized labs. And then next to the classroom, you'll see a digital consultation room. We are currently working with Cerner to purchase the RIS system, which allows the radiologic technologist to send the digital images to the computer that then they debrief and they manage electronically before the radiologist, the physician, takes a look at the x-ray so they can make sure everything's in order. Again, very much what happens in the real life setting so that our students will graduate workforce ready because they'll have gone through the whole flow as if they were actually working in a real clinic. So now as we leave the radiography area, we're going to go into the virtual hospital. This is designed to mimic a hospital setting. As we enter it, you see the nursing station here to your left. The virtual hospital contains 6 specialty labs, and on this side of the hospital, on your right, you'll see the emergency room, the intensive care unit, OB labor and delivery, and pediatric NICU areas. All of these rooms are live, state-of-the-art, just like you'd see in any current hospital today. It has all the auditory and the sensory stimulation that you'd find in any hospital. All of our simulations are videotaped, and the classroom instructor flags both technical skill issues